So I went back for my DNP primarily because in my practice environment, my practice setting, I was seeing that there was a lack of the sustainability of these evidence-based practice projects. And I thought, well, if I can inform myself, educate myself, I can bring some of that, to the practice setting. The other thing, Carol, that I didn't mention was when I had graduated from Western University of Health Sciences here in Pomona, they had asked me to teach. So that opened the doors to this other interest of mine, and it still is to this day. As you know, I still teach to teach pathophysiology and pharmacology to their, they don't call it their MEPIN program, they call it their entry-level nursing program, I believe. And so, so I taught, so that was also kind of opening the doors to kind of giving back. So I always felt like I had a foot in practice and then I had a foot in academia, so that whatever I knew was coming through academia, I would help bridge, with in the practice setting. Well, when I was at Mary Birch and I already had my DNP, Carmen said to me, again, we want to really build the research here. I also worked with neonatologist, Dr. Katheria, to help support the Neonatal Research Institute over there, which has been awarded several $million grants. And so I thought, well, if I'm going to be an expert in research now, then perhaps I need to take a closer look at, how can I educate myself and prepare myself. And when I had sat down with Carmen, she said, you should really reach out to somebody at UST, because I do know of one other person, and I think the person might have been in her cohort, that had a DNP and was exploring the possibility of a PhD. So I spoke with Dr. Roth at the time. I met with her. I had asked if I could, meet with her in person. And I shared with her my curriculum, why I wanted to go back. I was being asked to help develop this research program and support it. And it was myself and somebody else, and I can't remember the student's name. We were the first two that USD had that had already had a DNP, but was interested in going back for a PhD. And so she shared with me how certain classes I had already taken, I would have credit for. She is just, she's very near and dear to my heart. She's just a kind-hearted individual. And she always looked out for me. And I felt like I was always being watched out. She would call me or, email me. And she, what helped me also solidify my decision to continue on with that program was that I was one of the awardees of the Beister Scholarship program. So I was able to show some patient outcomes through my study that, I was awarded the scholarship. So I was able to continue with that work, and kind of my concentration at the time was women's focus because I was at Mary Birch. But a lot of this had to do with the fact that I was being asked to take on the research program. So again, I think my decisions to go back to school and to continue my education were based on what I was seeing in practice. I was the first one in my family actually to graduate with a doctorate degree, and have now encouraged my middle brother to go back to school, and that's what he's doing now. But I just remember my parents always saying, if you're going to do anything, just keep going with your education, and we're going to support you as best we can. And that's why they worked the two jobs. We were privileged to attend good schools. Obviously through loans and through scholarships, we were able to pay for college through work and that sort of thing. But that was always ingrained in us at a very young age. It's a very good time to be a nurse. I will say that, still in the pandemic. I would, there's also a lot of unknowns in terms of, patients, for example, not being able to see their primary healthcare providers and holding off on their care and then coming in sicker. Our patients are a lot sicker, the ones that we're seeing now coming through the ED. So the patient population is going to change, and I suspect that's going to be the case for the next several years, to be honest with you. We also don't know the sequelae, the aftermath of COVID. So if anything, I would just tell them, one day at a time. I know that a lot of things can seem very overwhelming as they're just starting in their nursing career. but that you're going to get through this as well. They're coming into nursing, as I said, at a very good time, but also at a time where there might be some unknowns, and that's okay. I think sometimes when we're novices in a role, we tend to think kind of black and white. And, I learned early on that life is really about gray. And we sometimes have to build a bridge while walking on it. And that's what we had to do with some of these COVID patients, because we had never taken care of COVID patients in the past. And let that be a lesson of, that when life kind of throws you a curveball, or when we take care of a patient that we don't know too much about, then we'll get the information that we need, and we'll do the very best we can. And the other piece of advice is kind of what my parents had always said, is just to continue on. If they're very passionate about what they're doing, they love it, and they want to continue with their career, then do so. And I just actually met with one of the labor and delivery nurses about a month ago, who wanted to go back to school for her master's. And so my door is always open to newer nurses, to anybody really that wants to continue with their professional growth and their professional journey. But those are the kind of things that I would say to them, that it's okay that, you're kind of coming into the healthcare profession at a time where there might be some unknowns, and that's okay. And know that, the patient population may look a little bit different. The acuity, the level of sickness will be a little bit higher, but, we'll working together and looking at, what are the best therapies and best treatments for these patients. We'll work through that, and, know that if they want to continue their professional growth, that there are opportunities to do so. Yeah.